Alright, this is for the upper extremity. We're going to focus on the scapula and the humerus and the rib and clavicle for the first section of your bones. That will be on the first exam when we get to that section in your syllabus. So you're going to just go to page 6 and we're going to start highlighting. We're going to highlight number 1, the manubrium, clavicle notch, body, xiphoid process, jugular or suprasternal notch. On the rib, we're going to write some things in. The head is also known as the vertebral facet, and then the tubercle is the transverse facet. So we're going to go off of those terms right there, and then we're going to do the body and the costal cartilage. You'll cross out costal angle. Then the clavicle is very simple. Sternal end, acromial end. Okay, we're going to flip that page over. We're going to go to the scapula, and we're actually going to know everything on this page. So just go ahead and start highlighting. So there we have the vertebral, also medial, so you'll hear me say it both ways. Same thing with auxiliary, lateral border, acromion, coracoid process, inferior angle, superior angle, glenoid cavity or fossa, infraglenoid tubercle, and then we're going to go over here to the supra, and then to the spine of the scapula, root of the spine, infraspinous fossa, supraspinatus fossa, subscapular fossa, and scapular notch. Okay, that's everything you need to be able to identify on the scapula. Okay, so from there we're going to jump to page 14. And we're going to start with the trapezius. Okay, so here you're going to know these individually. So upper, we have the external occipital protuberance and the ligamentum nuchae. For the middle and lower, as far as origin goes, I just need you to know spinous process. For the insertion, the upper trap goes to the clavicle and to the acromion. Middle is to the spine of the scap, lower is to the root of the scap. Okay. You need to know all the actions, so everything is included here as far as actions go. For the nerve, know that it's accessory nerve and cranial nerve 12. Okay. Please pay attention to this section. Okay. It's not something you have to memorize, but just go ahead and make sure you pay attention to the P, which stands for palpation. Okay. Also make a note to these little boxes down here, something that you are going to want to kind of read about as you go through. We're going to flip over here and we're going to go to the levator scap. So the same thing here, I'm not too concerned about you knowing the numbers of the cervical spine, that they go on just the transverse process. For the insertion, we're going to go to the vertebral border and to the superior angle to the root of the spine. So you have three things: vertebral border, superior angle, root of the spine. That's where it inserts. All of the actions: elevation, you will hear me say downward rotation. Okay, I typically do not use the terminology medial rotation. I use downward. And we are going to know dorsal scapular nerve. Okay, we will see C5, C3, C4 as we get into the nervous system and into the spring semester. And again, just pay attention to that. And you have your little boxes here. You want to make note that these muscles work together, the upper trap, and they shrug your shoulders. So both of those work together there. And we'll just keep going. Kind of the same process here. Something that you're going to want to highlight in your book and make sure. So rhomboids, we are not going to decipher them between minor and major. You're just going to hear me say rhomboids. So our origin is the spinous process. Our insertion is the root of the spine of the scapula. okay, plus the vertebral border, and from the root of the spine to the inferior angle, which you can see that all right there. Okay. Our actions, we have retraction or adduction. Okay, that's the same thing. And here, downward rotation. And your nerve is the dorsal scapula. And just kind of keep an eye on that area again. Okay. This is a little box here that just tells you how the shape of it goes and how it gets that downward rotation because of the oblique fibers. Serratus anterior. Origin, we are on the ribs. Okay. Insertion, we're on the vertebral border. Make sure you pay attention to the anterior surface. And then our actions, we have protraction, also known as abduction. Upward rotation, I won't use lateral, I'll stay towards upward rotation. We stabilize the scapula to the chest wall. We do depression, and then we can also assist in blowing out. And your nerve is a long thoracic nerve. Here's your palpation. Here's your, these originate with the external oblique muscle, and it's the strongest abductor of the scapula. Helps hold it against your wall. When you're weak here, you have a winged scapula. That's where that kind of tilts out. Okay, we have pec minor. Okay. So our origin is going to be ribs. Our insertion is going to be the coracoid process. And then we have our actions of protraction, depression, downward rotation. We tilt the scapula, and then we also assist with breathing in. And for the nerve, just remember pectoral nerve. Okay. Again, your palpation is something to keep an eye on. We're not going to worry too much about the subclavius muscle. Okay. You can make a little note down here that the subclavius prevents extreme elevation and protraction. Okay, it's kind of like your defense for any subluxing that clavicle there. Okay, pec major. It's a very busy muscle here. We have several organs. We have the clavicle, sternum, ribs, and the aponeurosis of the external oblique muscle. Okay, and the aponeurosis is right here. That's kind of what I'm talking about right there. And we're going to insert into the bicipital groove of the humerus. Okay. And we're going to pay attention to all of these actions. Medial rotation is also known as internal rotation. IR is internal rotation. And we have flexion, extension, and then we're also going to assist with tilting the scapula. We're not going to split the nerves into the lateral and medial. We're just going to do pectoral nerve. And again, we will pay attention to those at a later date. Kind of your palpation. Okay, it has the two heads here. That's where it's the pec major. It's the largest chest, and it forms the anterior portion of your armpit. Lats. It's the big muscle in the back. This is kind of the opposite of the pec major. So we have a lot of insertions here. All of these: thoracolumboponeurosis, spinous process, sacrum, iliac crest, ribs, inferior angle. And we're all inserting onto the bicipital groove. And we'll do extension, internal rotation or medial rotation, adduction, downward rotation, and assist with the scapula. And as the thoracodorsal nerve, I'm going to go with that. This is the widest muscle of the back. It is the most powerful extensor. When the humerus is flexed, you use this a lot with swimming, chopping, pulling. Use it with crutches or doing depression during transfers. And this gives you another little section of how you palpate it. Kind of makes up that posterior border of the armpit. Supraspinatus. Now we're getting into your rotator cuff muscles. Okay, So the supraspinatus here, we're going to go the supraspinous fossa. The name literally tells you where it originates from, and we're going to attach to the greater tubercle. We're going to do abduction, scaption, and also stabilize the head of the humerus. And this is the subscapular nerve, palpoid. Alright, here's your little box about your rotator cuff. It's your sits muscles. So you have the supra, infra, teres minor, and then you have the subscap. Okay. All of these are used to reinforce the capsule of the shoulder, stabilize the head of the humerus. If you don't have a stable humerus, then it is very hard to move the humerus without injury. Okay, so I know I highlighted there, but pay special attention to both of these boxes. Okay, to our second rotator cuff muscle, we have infraspinatus. We go to the infraspinous fossa, insert on the greater tubercle. We do lateral rotation, which is also known as external rotation. And we do extension of the humerus. And this is your suprascapular nerve. Okay, have your palpation. And then we have our little box down here. Again, it's all about reinforcement and stabilizing the head of the humerus. You'll get tired of me saying that, but don't ever forget it. Teres minor. We're going to the axillary border of the scapula, inserting onto the greater tubercle. Again, we will do external rotation and extension. And we'll do the axillary nerve. Okay. And it keeps repeating itself, reinforces, stabilizes. Okay. Subscapularis is the last one. We go to the subscapular fossa. This is where the insertion changes to the lesser tubercle, which is just below the greater. And we're going to do internal rotation and adduction of the humerus. And we only need to remember subscap nerve. And remember your palpation. You have your little box here. And I made that little note earlier. Okay, you're done with the rotator cuff. Now we're going to go into the teres major. You will hear me call this the little lat. If you go and compare the two, they're very close and they do the same actions. So we're starting at the inferior angle of the scap. In part of the axillary border, we're going to insert onto the bicipital groove. We're going to do extension, internal rotation, adduction. And this is the subscap nerve. Palpation. Okay. So the latissimus dorsi and teres major, they lay together and they share the same actions. The infraspinatus and the teres minor pull downward to stabilize that head during abduction. Okay, so these are your stabilizers when you're moving your arm out to the side. Alright, your delts. So you have 3 of them. This is your big muscle that if you cup the side of your shoulder. So we're going to separate them. We have anterior clavicle, middle is acromion, posterior is the spine of the scapula. They all are going to insert on the deltoid tuberosity. Okay. Your anterior does flexion, horizontal adduction, and internal rotation. The middle does abduction to 90 degrees. Okay. Posterior does extension, horizontal abduction, external rotation, and scaption. Your nerve is the axillary nerve. Here's your little palpation. This is your strong abductor muscle. It's the rounded muscle of your shoulder joint. Note this muscle cannot initiate movement because of its angle. Your initiation comes from the supra. Alright, we're almost done with the shoulder. We're getting there. We have the coracoid brachialis, going to the coracoid process, doing to the humeral shaft. Action is flexion, adduction. This is the musculocutaneous nerve, and palpation. Okay, this is an easy one. It's named for its origin insertion, so you should never forget where that muscle starts and stops. Okay, biceps. We have a short head and a long head. Not too worried about that. Just know that the biceps start from the coracoid process and the supraglenoid tubercle. Insertion is the tuberosity of the radius and the bicipital aponeurosis. We do flexion of the elbow, supination, and then we can assist with flexion of the humerus. Musculoskeletal nerve, palpation. Okay? Biceps means it has two heads. Brachialis. We're kind of moving now into the elbow muscles. So your brachialis muscle starts on the humerus, inserts on the tuberosity of the ulna, and the coracoid process of the ulna. Action is going to be flexion of the elbow, nervus musculocutaneous, palpation. Note this is the strongest elbow flexor. Okay, our last one here for the shoulder and elbow. It's going to be your triceps. We're not going to divide it up. We're just going to add infraglenoid tubercle, humerus. We're going to insert on the olecranon process. Actions are extension and extension of the humerus. This is your radial nerve. It's kind of how you palpate. Then you have your little anconeus muscle back here, lateral epicondyle, the olecranon process, and assist and extension. That's the radial nerve. Here's your little box of the triceps, meaning 3 head. You have the long head on the infraglenoid tubercle, and the long head of the bicep. Originates from the super, so one's above and one's below. Okay, that is all your muscles for the shoulder and elbow, which reminds me we need to go back and look at the bony landmarks on the elbow. So let's just pause here and let's go do our bony landmarks and get ready for your next section as well. So we're on page 9 now. Let you turn there for a second. And then we're going to just go through these, and that'll get you set up for the next video as well. So for the radius, we're going to do the head, neck, tuberosity, interosseous border, styloid process, and the dorsal tubercle, which is also the ulnar notch. Okay, then we're going to go to the olecranon process, the trochlear notch, choroidine process, radial notch, tuberosity, interosseous border, styloid process, head, supranator crest, and then we won't need to worry about the posterior border. Okay, I'll get you started, and then we'll get to the wrist and hand in your next video.